Erica, you ready? All right. What was that?
You.
Are you just live Instagramming me? Okay. Erica is a dance therapist and a clinical counselor with the passion for the power of movement for mental health. Give it up for Erica.
All right, good evening, everybody. Come on, a little bit more. Good evening. All right, my name is Erica. I have my master's degree in dance movement therapy from Columbia College. I own a business dedicated to dance movement therapy, and I'm a media expert on dance movement therapy. So you're probably thinking, what is dance movement therapy, right? You wouldn't be alone in that question. A lot of people ask that question. And I find that it's easier to talk about what it's not before we actually define what it is. So people will ask me, are you a therapist for dancers? That's a good question. Here we have a little hokey pokier trying to turn herself around. And that's not exactly what I do. I'd love to see more dancers, but ideally not really the population that I work with. People will ask, do you teach people how to become better dancers? Again, something that I would really enjoy doing, but I like to say that I bring the inner dancer out of everybody, not teaching them to become better dancers. Lastly, people will ask me, do you use dance to help people feel better? Okay, now you're on the right track. However, feel better is kind of subjective. We don't always feel better, but it's about expressing ourselves. So what is the actual definition? Dance therapy is the psychotherapeutic use of movement to promote emotional, social, cognitive, and physical interaction and integration of the individual. Mouthful, right? So how does it work? Dance movement therapists like myself use movement as the catalyst for change, as an intervention in the therapeutic relationship, and to observe and assess the client and where they are. What are the benefits? Well, it can boost mood, it can help you identify who you are, your core belief system and your values, it can help you keep calm and carry on, and it can actually enhance your cognitive ability, maintain and even build new memories. Who can benefit? Really, anybody with a body. However, I find that it works very well with people that either don't have the ability to speak, can't find the words to speak, or just don't know how to express themselves verbally. So why does it work, right? Why? That's probably what you're all thinking. Why does it work? These are the reasons I think it works. Some quotes that I've come up with that I'd like to share with you. First and foremost, 93% of communication is nonverbal. So only 7% are actually the words that come out of your mouth. 93% of it is your body language, what you bring into the room before a word is uttered, right? It's the temperature in the room, right? It's how powerful or confident we feel, right? It's how engaged or how lifted or how calm maybe we're feeling in the moment. I like to say that the body expresses what the mind suppresses. Think about that. The body expresses what the mind suppresses. The body's always talking. Our mind likes to cover it up. You'll never resolve emotional issues without addressing the body that houses them. We think we've worked through things, we talk through them till we're blue in the face, but our body hasn't quite let go of them or worked through them. Movement is an extension of the self. Movement is an extension of the self. Therefore, a change in your movement impacts the person that you are. Change your body, change your mind. So repeat after me. Can I try it?
Can I try it?
I thought you'd never ask. Stand up. We're going to practice some movement therapy by breathing, first and foremost. So we're going to put our hand on our abdomen and a hand on our chest. I can't do that because I'm holding the mic. And I want you to breathe into those places as if your torso was a balloon and allow it to inflate. And then allow it to deflate. Good. Next thing I'm going to invite you to do is stretch, whatever that means for you. Reach into the dimensions around you, something we call our kinesphere. Reaching in front of you, reaching behind you. When you're done, you can have a seat. Typically this lasts for 60 minutes, so you're lucky it was only 60 seconds. All right, practice body talk. Next time you feel something, happy, sad, angry, upset, nervous, overwhelmed, ask yourself how you know you feel that. Where do I carry that emotion in my body? Try it, you'll be surprised. And lastly, when words alone are not enough, we must look to the body. For in the body lies answers to questions we never knew to ask. Thank you.